From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush. Teri, welcome to the show. I think you hold the on arrow now of actually being our first returning guest, so maybe the jacket will be in the mail. But for those who don't know you, Terry Sun, Chief Strategy Officer at White Rhino, a digital marketing agency that specializes in building trust between brands and consumers, and with a very heavy particular focus in healthcare. But I'd love just in your own words, kind of what does that mean? Give us a kind of overview of your experience and kind of what's bringing us to this conversation today.
Yeah, it's really great to be back, Brian. I remember when you and I first met, and I learned about Tidal, and the thing that really drew me to the work that you all do is thinking about what is the patient's perspective when it comes to somebody searching online, and that's really how at White Rhino we approach things. And me as a strategist, I approach things is really looking at it from the patient perspective. We always talk about how when you're thinking about digital website strategy, we're focused on how do we bring that patient point of view to your digital stakeholder team. You've got compliance and clinical leaders and research and all these different stakeholders. How do we make sure we represent the patient voice in those discussions? And so that's really our focus. We use a lot of psychology and neuroscience is our background. And hopefully we'll talk a little bit about that today. We're doing some exciting things with how do you actually train AI to be more empathetic and to leverage some of those psychological frameworks. But we do all that to really translate and understand what really drives people to make these critical decisions in their healthcare journeys, what holds them back, and then how do we line up the right communications and digital touch points to make sure that we're actually helping patients move forward in their care journey and getting access to the critical information and resources that they need.
It's pretty pointed and concise, and yeah, you and I can range in a lot of areas. But I'm curious. Like over the time I've gotten to know you, I think we've kind of waxed and waned about kind of how healthcare can be slow to things, and I think there's an interesting ability now, this teetering point with AI. And I'd be curious as you start to kind of think about focusing it down, where is your kind of front of brain and what's most immediate and valuable in terms of healthcare marketing and utilizing AI?
Yeah, I think to your point that healthcare has been a little bit slow to adopt things. We've done a lot of work with business to business companies and in the consumer space, and healthcare has always trailed behind. But I think this is a prime moment for healthcare marketers. The technology is finally at a point where it's really mature and we can do some really interesting things when you bring in AI into the equation. That it's actually not bad that healthcare maybe trailed behind. They had some important other things to focus on coming out of COVID, standing up chatbots, things like that, online appointment scheduling, virtual care. And so the fact that they've been maybe behind on the digital front is okay, but now's the opportunity to really kind of seize what's available. And there's a lot of best practices we can take from other industries. And really where I like to focus is on this topic of personalization. There's so much evidence that personalizing a website interaction, and not just your traditional personalization where you say, hey Brian, welcome back, and we know you maybe by name and know some demographic things about you, but really tailoring the conversation to your unique needs, your emotional needs, not just your rational needs. And there's a lot of evidence in other industries that you can increase the ROI of your marketing spend 3 or 4 times or more. And also it makes a better experience for the patient too. So I always talk about it's a win-win for both patients and marketers to be able to personalize web content. And AI is really allowing us to do that in a way we've never been able to do before.
Let's try and double click on kind of the how underneath that. I
Yeah.
think there is such an old school kind of traditional definition of personalization of this like click button, like, are you a consumer? Are you a provider? And like, that's the level of personalization I still think in a lot of people's heads.
Mm-hmm.
And then now coming in this wildly productive and efficient tool that we can focus with AI, how do you think about not getting caught in it just as a speed play of making more efficient what is a different way. Like, how do you explain bringing the deeper value of AI into this strategy now?
Yeah, what's interesting is we used to have to serve static pages when take a brand campaign, maybe you're marketing a service line. Let's say for your pediatric cardiology department, we have a client that works on that. You would have to design one landing page to serve all people, and so we get this long landing page, and then we try to make the call to action, schedule an appointment front and center, and we don't really have the ability to, in that experience engagement with the patient, to slow down and have a conversation with them the way a doctor or a nurse navigator might, because we have to just design one static landing page for everybody. And the beauty of AI is we now have the ability to actually dynamically change all that content on the fly. And that's where we see, now we're a few years away from that being truly generative, but a patient coming in with a certain keyword into that campaign, and knowing, even just knowing if they've already had a fetal echocardiogram or they haven't, you can actually change that whole landing page experience to adapt to their needs.
Is it a different way of like reflecting that back to you, basically saying like addressing your concerns? Because you can think of something as simple as that as, hey, everyone may be coming to try and schedule an appointment that may be the end action that this cohort of users is, but their concerns and questions around them can vary wildly.
Yeah, and not everybody is, well, that's the end point. They're at different stages of their journey, and some of them are not ready, and often never get to the point of being ready to schedule that appointment. If you think about, go back to this fetal echocardiogram. If I'm a busy single mom, or working parent, and I don't have time to take off for this test, I'm not sure if this test is really going to tell me anything that I can change. I may have skepticism about the healthcare system. There's so many factors that prevent me potentially from scheduling that appointment that we all know is the right thing for that patient to have. But how do you help
Mm.
them start to understand? Maybe they're just scared. And so how do you guide them through that? And most traditional healthcare websites and landing pages are not positioned to really help the patient through that emotional journey. And while we're seeing more and more patients go to ChatGPT or out to Google and using AI mode to research health topics, they're also not really guiding patients through that experience. They don't have that soft hand holding that some of these patients need. And it's not that they're not going to schedule an appointment, but they're not ready. So how do we get them ready? How do we make sure they have the information and the emotional support to be able to make that decision for themselves?
Add some more color to that too, in the sense of like double click on that information and then also emotional support. Like, what is it that you're surfacing and where are you pulling it from?
Yeah, again, most traditional websites we're giving patients a lot of definitions, helping them understand what possible diagnoses are, tests, what are symptoms. We're essentially trying to be encyclopedias and dictionaries. A lot of that's now getting solved with generative AI, and those are great questions that I've actually been very impressed with the quality of medical information I get out of ChatGPT. I've researched personal and family health issues with that, and it checks against my healthcare knowledge. Right, been working in healthcare
Mm.
for years, and so all those more informational questions are getting answered. But we're all in healthcare because we know that there's an important mission in healthcare, which is helping these patients deal with a really large amount of uncertainty. When you're diagnosed with a condition, you've never dealt with this in your life before. You don't have a process to maybe make these decisions. And how can we really help guide the patient through that? If their informational needs are getting answered by ChatGPT, how does that maybe shift the role of the hospital website to provide more of that emotional support, to give them some reassurance, the way, like I said, like a nurse navigator
Mm.
might say, that's very common to have questions about this procedure. You're not alone, and here's what how other people have approached it. Those are the types of information that, I mean, I think we all need as humans. We want to understand, how have others dealt with this? How have others like me dealt with this type of situation before? Those are the things that help us reflect on the decision we want to make, and move us forward, and rather than us sort of sit there being kind of paralyzed because we're not quite sure what to do.
Yeah, I'd love to inject this kind of concept of speed now into depth.
Yeah.
That I'm curious what comes to mind when you think about the kind of resulting effect when we have this informational encyclopedia online, but now we're building all these databases, data back personas, and we're able to compress the speed of delivery of that. And that one
Mhm.
example I think you gave is the pediatric that took weeks to build a single landing page to serve a huge, so that kind of funnel is down to one page serving a huge community. So what happens now when that gets inversed and we're having so much personalization at scale and speed?
Yeah, you really are flipping that, right? Like you said, traditionally you spend a lot of time to get to one point that is kind of generic. It isn't very useful. It's useful to some people, but it's not going to be useful because it's not personal enough. And we're flipping that, where you can have a small input with it. And when I think on the back end, just in before we even put AI powered chatbots and things in front of consumers, there's a lot healthcare marketers can do on their own with AI. You can give AI a few simple inputs in terms of the audience that you're targeting, and you can get a full personalization strategy to cater to all these many different audiences. So we've really flipped. Now we're going from one input to many outputs, instead of many inputs to one small output.
Is there any more color to those inputs that people should be thinking about? What categories of information or prioritization in those inputs?
Yeah, I think the way I like to think about it is more the quality of the input, and the context. I find, so let's take, for instance, if you want to understand how to personalize a landing page to different audiences, and let's say, again, you're dealing with cardiology in a pediatric space, you could go to ChatGPT and you could ask it, I'm building a landing page, give me 5 personas that I could target in different ways. That's a very basic level question, and the additional context you put around that is really important. So we're doing a lot to think about and help our clients really train the AI around their brand, around what they already know about these patients and those patient journeys, and give it a little more fine-tuned context so that the quality of that output is better. I find when a lot of people are getting started with AI, they get frustrated because they get a little bit of quality out of it, but they say, like, I could still do this better myself. It's not great, and it's because of the quality of the inputs and the context that's given. But we've had a lot of success when we give it more of a framework, when we give the AI a framework and a mental model to think about, like a psychological framework of what drives and motivates the patient to make a decision to schedule an appointment. When you give it some of that framing, now the AI can be a bit more focused, and it gives more fine-tuned insights. And we've found really, really valuable insights that that's when you get to the point where you put in three or
Mm.
four words and you get an output that's really good quality, that you feel comfortable moving forward to the next step. And so I think that's how I really think about it, is making sure you're giving good context around that one input.
So, way to think about that quality inputs, like, is there a client specific discovery essentially that's happening to really just understand what data they have? Because not every client collects the same
Mhm.
data universally. So I'm curious if that's kind of the lens of where you're thinking that there isn't a universal answer to the inputs, making them quality. It's a bit of a uniqueness to the client and kind of understanding their brand, what they have collected in some kind of structured or unstructured format.
Yeah, and because we want to make sure that the AI response is generating something that is unique to your brand and is going to that your strategy is going to be reflective of the type of patient experience that you're trying to drive, is reflective of the services that you offer. And so having starting with a good base of who you are as a brand and not just your services and treatments as a health system, but what is your approach to care? What are your values? What is your involvement and engagement in the community? How do you show up as a brand with patients? So having that context can really make sure that the output is true to you, and it's not just what any other health system could say, but it's specific to your health system.
I'm curious, like further moving down that kind of discovery lens, how does the dynamic or the process of building a website change? I would categorize, and you can correct me if I'm wrong, kind of tradition up to this point has been a little bit more sequential in terms of maybe the discovery, kind of the strategy on the brand side, kind of wireframing, content, kind of design, SEO, is kind of these more sequential kind of down assembly line process. But the heart of what I'm hearing from you is this kind of connective tissue of sources of data and roles compressing. Like, I'm
Yeah,
curious what that
definitely.
means to you now in terms of what the process to discover and develop websites will become.
Yeah, definitely. Yeah, traditionally, website, any product or service is a it's very waterfall approach, and you do all that upfront work, and you have checks and balances along the way to make sure you're still on track before you move to the next step. And we're finding that being turned really upside down, both in terms of you can much more quickly move through any one of those steps. So I can now generate, rather than going out and doing 5 months of research, I can generate the same quality of insights in about 30 minutes, sometimes in 5 minutes, depending on the tool that you're using, and end up with really high quality psychographic personas that would have normally taken me months. So we can shorten each phase, but also we can really more quickly iterate and prototype things. There's a lot that we've been doing with, if people know the term vibe coding, which is essentially working with AI to generate code for you, sometimes not needing to have a developer touch it. It's a whole separate conversation you should
Mm.
have, especially in healthcare, developers who understand security and all those things, checking that code. But what you can use these tools for is you can quickly prototype an idea. We've done this a lot with analytics dashboards. Rather than spending all the time up front to think through what information we want to go into a Looker Studio dashboard, and then making sure all the data connections are there, and then building it, and then getting the final product and thinking like, oh, that's not quite what we wanted, or it's not quite effective. You could now, within 10 minutes, you could prototype a few different dashboards, even based off of real data, to see what you like, what you don't like. And so you can use some of these tools to prototype more quickly and see what's closer to the end product. And I think what's cool about that is it makes these things that feel very intangible early in a discovery process. You know, you kind of have a vision, but you're not quite sure where things are headed. You can more quickly make that end product tangible, and you can make some quicker decisions at the start about what's going to work and what's not going to work. And so it really is conflating the process and making it yeah, much more iterative. Yeah.
Yeah, that was the word I was thinking, and I was going to ask and see if that's a correct characterization. I'm seeing this very iterative, like circular workflow. I mean, just thinking about in the time frame that you said, it could be, I think you said 5 months talking about like research and persona building, where there's a little bit of a blind faith of like, what are we
Mhm.
working towards to then hand off to the next kind of responsibility in the project. To the other side of the time was 30 minutes.
Yeah.
So what does that dynamic now look like from the researcher and the strategist, say, working with the designer, if we're now getting information 30-minute feedback loops?
Yeah. Yeah. And it's interesting. It really shifts how we need to think about doing work. And we've been finding this in as we've run through some of these processes. Traditionally, you also don't really go back to that research. And I think we have the opportunity, and we also need to think about how we're continuously developing and refining personas at every step of the way. So it's not you take an input and then everything else happens, but you're continuously iterating each piece of it. And I think that's what's going to ultimately get us to much better experiences, much better outputs along the way. Yeah.
I'm curious, it may not really be an answer here because we're dealing, but I almost think the opposite now too, of like, do you apply deadlines and limitations? Like, how do you think about, or are you thinking about just this like iteration death spiral?
Yeah, we do we definitely are shifting to more sprint based approaches, and
Mm,
what you find when you're doing a really AI driven project, when you're really looking at how to use AI to improve a particular process, what we've found is the schedule you and the timeline you establish and the tasks you establish at the start of the project, they're not relevant as you move through. So we even have to think about a high level sprint schedule. You need to have some key milestones that you want to achieve, but you have to be a little bit comfortable with letting things evolve the way that they're going to evolve and not try to over engineer what all the steps are. Traditionally, in that waterfall approach, we needed to understand all the steps in the development process and really plan out each of those steps so that we could meet our schedules. But the way to meet schedules now is to make sure you have a healthy way to iterate and refine and still meet key milestones. But it's definitely a shift in the way that we work, and we're all still figuring it out, right? But starting to recognize those shifts and changes, and being open to exploring new ways of thinking and working will help us, figure that out.
yeah, how are you applying the persona builder or just like the persona research to phases or the entirety of a project? Because I'm curious, you brought something up interesting there. Like traditionally, we'd have these kind of like cliff milestones within a project that piece of the project is done at that one point and it moves forward really without ever looking back. So it can only get to a state of whatever information it had at that phase of the project.
Mm-hmm.
And it sounds like I hear an argument that we're going to become much more iterative in the amount of information we receive. So we have to have some level of flexibility that we're going to discover things that we didn't plan for. I think is a lot of what I'm hearing. So how do you think about, are you deploying that kind of throughout now the whole process or still segmenting it to phases throughout?
Yeah, I think personas is a really good example, and then maybe I'll extrapolate to how you can think about this for other parts of the process. But the value of personas is to have that patient perspective on what you're creating. And typically, we create the persona up front, we draw some conclusions, and we carry those conclusions forward that patients prefer this or patients behave like this. But even further than that, we typically then say, and because of that, we're going to do this. And we sometimes lose the connection of why we're doing that. The interesting thing about AI is you can train AI, you can train a single AI agent on a particular persona. We call them experts. So what we've been doing is creating experts that represent our different patient personas. Think about it as your traditional persona card, but in an AI model. And then we bring those experts into each step of the process. So if we're reviewing a wireframe, we ask the persona, what do you think about this wireframe? Rather than using those often generalized insights that we may have been getting. And then we get the experts' personas to work together to kind of debate, especially if you're still in a mode where you have to serve up one landing page. Well, how do you pick what's the best way to word a headline on that page, given this variety of input from different personas? You can get them to work together to figure out what's going to be the best headline that's going to appeal to all of them. So I've been thinking about using AI to give us these expert perspectives that provide input at every step of the process. And of course, every step of the process, there's going to be an overriding perspective. If you're in wireframing, the wireframing expert is going to, be the main decision maker there, just like you would in business process flow. And if a real person gave you feedback, you'd say that's good feedback, but best practice or whatever it may be, this is how we're going to approach that. But yeah, you can bring these voices to the table at any part of the process. And even also then thinking about, you can bring that wireframer into a brand voice discussion, or you can bring a designer into the wireframe discussion, both a human or use an AI version, bring that expertise. So it allows us to better consider the system that we're trying to design. Because when we think about especially digital, there's research, wireframing, design, development. But at the end of the day, we're trying to create this really integrated system. And we can now kind of think more about the system along the way because we can bring these perspectives in at every step.
Yeah, and I want to double click on that because I think you just lit the light bulb in my mind around a question I wanted to answer, but with and now me being able to add a lot more context to that question.
Yeah.
And it's this kind of involve and design the process along the way point that the question I wanted to ask was like, what does the dynamic around kind of the traditional roles within, say, a website project look like? And I think a distinguish you just made that I think is even kind of wildly leaning forward for me is traditionally you would have this kind of waterfall process that we laid out that had a static kind of determination that moved forward. It was even a limiting way to think about AI that, okay, great, we can get that static information and we're just getting it quicker. That's already a gain. But what I think you're now saying is you're carrying forward almost like other seats at the table, dynamic versions of these personas that you're bouncing questions off of throughout the process.
Yeah. Yeah, a good example, we're working with a media team right now, and you've got your social media expert, and you've got your digital, paid search expert, and you've got your traditional expert. And traditionally how this team has worked is each of those people evaluate the results of a campaign individually. They run their little individual analysis, and then they report out to the team, here's what I'm seeing here. And there's a lack of sort of cross-channel insights and collaboration and strategic insights that kind of cross the whole campaign. And what we've been doing is infusing more AI into their process so that they're spending less time thinking about we're creating efficiencies. They're not thinking so tactically, just trying to crunch numbers. So we're kind of freeing up their time. We're allowing them to think more strategically, both about their domain, but also giving them perspective and allowing them to think about those other domains that are not their core focus, but they understand and they understand. So we're allowing everybody to kind of think broader about that system.
And I think that example too is tremendous, but even that's like post-project analysis and analytics, where to bring back the kind of persona and web, I do want to make tell me if this is a poor or wrong visualization is it's almost like any project that we're doing where we're trying to build something that's in support of an end customer. At the end of the day, I think we would all wish could we have 5 or 7 of our customers hand holding us throughout the entire process and
Yeah.
project, giving us real time feedback?
Mm-hmm.
Like that's what I'm hearing you're proposing is
Yeah.
not only are we compressing the speed of gathering information to define the personas, whatever amount output that we agree,
Mm-hmm.
3, 5, 7, we now have a dynamic version of that persona that we can converse and
Yeah.
bring into the conversation with the traditional role that was in that project before.
Yeah.
Am I
Yeah.
characterizing that?
100%. Yeah. It really allows us to bring the patient to the table every step of the way and make sure that the output reflects what they really need. I do want to emphasize, though, that this shouldn't be purely AI driven.
Hmm.
I mean, I can use our healthcare persona builder. I can get 4, 5, however many I want, emotionally resonant personas for a particular type of patient in a matter of minutes, and they're good. We've analyzed them against different psychological frameworks, and they're really good quality. But at some point, you do want to validate those with your audience, because if it delivers me 5 personas, I still need to figure out which of those 5 personas are still most prevalent in my community,
Hmm.
or are there nuances? Are we misinterpreting or over assuming certain things about a particular persona? So we do need to pair traditional research, I believe, with when we're talking about persona development. We shouldn't rely solely on AI. We need to feed it with
Yeah.
real patient data, and but maybe it's also flipping the equation of when that research happens. And rather than doing research and then creating personas, you're creating personas, you're prototyping personas, and then you do the research to back it up. And so we need to make sure that we don't slash research budgets, right? That we're still planning those verification steps, or we're investing in tools that have done that verification already. And there's a lot of different tools and technology out there that you can make sure it's grounded in some good, real human insights, not just AI generated.
Yeah, it's an important distinction, and I'm glad you made that too, because there was a visual kind of coming in mind with me of just like where does the human's input
Mm-hmm.
come, and where does it come in terms of speed? And I'd be curious if this is a validation back of listening to you. I'm thinking of this kind of compressed barbell visual that I sit with a lot of the quality inputs comment you made, which is the front end of the barbell, that the human has to spend a lot of time making sure we're inputting quality
Mm-hmm.
information to educate the AI, which allows the middle of the barbell to run very quickly with the least amount of human input. But then the back end of the barbell is we need a lot of human review still, even through that process. Is
Yeah,
that a
100%. And I think the front end of that is not it's not every task needs a lot of human input. But if you look holistically at the things you're going to use AI for, you can identify patterns in and identify some key frameworks that you can give to the AI. Then when you're spinning up a new request, it's following those frameworks and you're getting those quick insights. But then to your
mm,
point, we need to make sure that there's human verification along the way. One thing that we've found in using personas in strategy is you can't just have the AI. It's like, and traditionally we would say, like, don't, you can't just like throw something over the fence to somebody else and be happy with the result. You can't give the AI and say, hey, create 5 personas and design a landing page and develop the landing page. You can't just throw it over the fence and expect that you're going to understand and be happy with the outputs. And you still need checks and balances, just the way you would if you're working with a team. You would still have project check-ins. And so as we design AI agents, we think about how we keep that human involved throughout the process, and we're getting their feedback. And I think there's a lot of fear certainly on the employee side, that like, oh, AI is going to take over my job. And I definitely hear a lot of executives talking about, well, how can I eliminate the need for a human to work on certain things? And what we're finding is that you really can't eliminate them. You can very much decrease their time. So now they can work on many more things at scale. But you still, I'm going back to this media team
Mm,
example, we still want that social media strategist to just double check the insights that the AI has generated before we hand those insights over to the AI agent that develops the story narrative. And we want the
mm.
account manager to check that story narrative and iterate a little bit with the AI before we send it to the client. We're not just going to go end to end with AI and not have a human provide feedback.
Yeah, using that media example, I mean, is there any more insight you can give to how you're thinking about it could just be an individual's role changing, or maybe the dynamic of that consortium of roles? I mean, you gave us some insight to they're handing over a bit more of the data crunching, kind of even production of insights.
Mm-hmm.
So, what does that then mean to you in terms of that individual's focus, role, or the dynamic
Mm-hmm.
of that department?
Yeah, everybody becomes much more strategic and enjoys work better because they're they're thinking. They're able to. They're not doing mundane number crunching, but they're able to think and provide their point of view, their perspective, and right. They're providing a much greater value, and that's personally rewarding for anybody working in the space. So they become much more strategic. I'm not sure what that means. I don't know if that means that they're just going to do a larger volume of work, where maybe
Mm,
currently if you're a healthcare marketing manager and you've got 15 service lines, does that mean you now can put more strategic input into 30 service lines?
mm,
Or is it where people will start to kind of expand their skill set and more people will have kind of maybe that social media marketing expert now also starts to venture into some other domains, some other channels.
mm.
So I'm not sure how that will work out. I think it's going to depend per person. I think people are motivated in different ways. It's going to depend per company as well.
Maybe just like broadly looking at it from the potential patient's perspective, like what excites you the most about this, that we're able to get to this level of personalization and iteration? Like, what does the output of that mean to healthcare or that patient?
Yeah, 100%. I think it's the best thing for the patient. I mean, yes, there's going to be a lot of benefits from a ROI perspective for marketers, but it's just going to be a better patient experience. We've been prototyping some experiences that use AI and provide this much more conversational way of engaging with healthcare website content. It's not a chatbot. It's not search. It's not website. It's all those things combined, and it's more like a conversation we talk about. We compare it to if you took the best psychologist and paired them with the best physician. It's that, and maybe a nurse navigator in there as well. It's that human. It starts to feel like a more human conversation, even though it's all digital and AI powered.
Mm,
And the most important thing is it's getting the patient to clarity. I mean, when you're diagnosed with a medical condition that you've never dealt with before, there's a lot of uncertainty, and it gets that patient to a level of clarity faster because we're tailoring those messages and that communication to what they really need, and they're not having to search through pages and pages on Google. I've used some of our tools. My father-in-law recently had some health issues, and I used some of our tools to research about what he had a pancreatic stone, and was kind of researching what was going on. And afterward, I spent maybe like 10 minutes with the solution, and I sent my husband a summary and said, here's what I found. And I got a lot of clarity in 10 minutes. And then I sat back and I thought, that probably would have taken me a few days to get to that same level of clarity and understanding had I just done traditional Google searches and gone out to different healthcare
mm,
websites. And So it creates, yeah, it's creating efficiencies on the marketer side, but it's also creating efficiency on the patient side, but not efficiency in like a functional way, but efficiency in the sense that it's getting them to clarity sooner, and that's really cool.
Yeah, I'm curious. I might be really pushing us out on a ledge, but now hearing even that father-in-law's example, I would have to like. I'd be curious your thought. Like, wouldn't this improve health outcomes? I mean, if we're compressing the access to information, addressing concerns and fears faster, from even just a preventative standpoint, wouldn't that get people access to care faster?
Yeah, I think that's one of the biggest first opportunities, kind of first frontiers of a more personalized, emotionally intelligent, and AI powered web page and web experience is those service lines that really it's important for patients to take those preventative steps, to do preventative testing. And you have a lot of indecision right now where some patients just don't move forward with those things, and a solution like this can get them to think through what their concerns are and to overcome those concerns to get them to a point of decision faster. Yep.
I know it's probably hard to use in word. Like, what does this web experience look like? Like, when this emotion
Yeah.
forward hyper personalization, like, should we be shattering and reframing what we expect and think websites look and feel like?
It's very different, and I I've tried to explain it many times, and it's hard until you see it. So if we have time, I could show you like a little clip that shows what it looks
Yeah,
like if you think.
please. Yeah.
Okay, so this is just so you have some context because there's no audio. It's just a short clip. But imagine this is a healthcare website of the future. Think of it like a service line landing page. In this particular
Mm.
case, the example we're going to show you is for BPH, a patient looking for BPH treatments, enlarged prostate, trying to understand sort of what's going on with their body, what their treatment options are. And this is what I mean when I talk about it's not a chatbot, it's not a website, it's not search, it's all those things combined. So I'll just play the clip and then we can talk about it. So immediately it's welcome you to the experience, right? It's conversational, and it's asking you, it's more like a decision aid. It's asking you where you are in your level of worriness, and then it's responding to you. So we've already moved past that static landing page. But at any time, chain of thought, a patient can ask any sort of question. Here they ask about a particular treatment, resume. They spelled resume wrong. It corrects them. It gives them a little bit more information, gives them options, serves up what's the next best step that might move this patient forward, but giving them several options for them to, it's like choose your own adventure. Where do you want to go next? So the patient's really in control and guiding that conversation. And we start to really rethink what a website is. Again, not a long landing page of text, but much more interactive. And there's a constant, we've talked a lot today about
Mhm.
iteration. There's a constant iteration in the conversation where with every input from the patient, they get a new output that's aimed to move them to the right next step.
No, this is really helpful. The one thing that jumped to me was there's this kind of scalable qualitative input that you're giving to the patient. I mean, the right up front was just like, what emotional state are you at? Like, where that lands will wildly vary kind of what state of information that they're looking for.
And when we think back again to the marketing objective of, I want this patient to schedule an appointment, if they're high on the anxiety scale of being worried, they're not going to schedule an appointment. They might schedule an appointment that actually, people on that far extreme, they may just need to talk to someone, right? And they need to get into an appointment. If they're not very concerned at all, maybe they just have a few quick questions. Let's serve up that request an appointment call to action sooner. But if they're really
Mhm.
worried, let's kind of go through the conversation maybe one step or more too before we say, hey, do you want to request an appointment? Let's not over assume that they're ready and have them get annoyed. I mean, I can't imagine how many patients are annoyed when they go to these service line landing pages, and we've seen it in the data and the analytics. They're looking for more information. They're still exploratory. And we're just asking them to schedule an appointment. And they're like, I'm not ready for that yet. And they're clicking on all these other links because they're not ready yet. And so this allows them and helps them get ready, and it keeps their trust, right? If you're constantly asking for that conversion, that request an appointment, you start to erode some of that trust.
Mm. Yeah, I'm curious if this is like I'm trying to anchor it to kind of a current state of play. And you made a comment, I might butcher a little bit, but it was something around like it's not static websites, it's not AI agents, it's not open conversation, it's kind of all the above. I mean,
Mm-hmm.
is it anchoring to help people get their headspace of what that looks like? Is that almost the state of play of the race within, like when I think about like AI mode within Google, how they're trying to like kind of create this multi-dimensional
Mm-hmm. Yeah.
contextual input, is
Yeah.
that kind of a good anchoring to think about what you see as the future of websites?
Yeah, 100%. And there's a lot of innovation going on in this space. So we're still early. I think it's important for healthcare marketers to understand this is where things are headed, but they don't have to like jump on this at the moment. You don't have to
Hmm.
go rework your entire website today. There's stepping stones to get there. Microsoft's driving a lot of this is called generative user interface. Microsoft's driving a lot of innovation in that space. We see content management providers like Sitecore also driving a lot of innovation in this space. So this is a experiment and watch and learn sort of phase for healthcare marketers to, but also to keep in mind, okay, when I'm evaluating, maybe I'm in the process of thinking about rolling about a chatbot on my website, looking at that company's roadmap and making sure that they're either headed in this direction or you're not signing up for a 5-year contract, because if this is sort of the way that websites will function in the near future and you're going to need to divest in some of those traditional solutions, chatbot's going to merge with this other thing, you don't want to overinvest in something right
Hmm.
now. And we're already seeing signs of, like, on my phone, you've probably noticed if you're on a web page and you kind of click on your phone and just touch your screen for a little while, it starts to highlight the text and your AI assistant comes up and asks you what you want to do. And so we're starting to see websites become more interactive. So I don't think it's very far off. I would say certainly within 3 years we're going to see a lot of websites much more dynamic like this. We're going to be rolling out some landing page experiences this spring that already are AI powered like this. So it's coming fast, but no, you don't have to go rethink your whole website today. But you should start being aware of what's out there, thinking about that future, and really the best starting place is to use the tools that are available today. Start to understand your personas better and your audience better now that we have the tools, where a healthcare marketer used to not be able to really think in great detail about all 30 service lines that they're marketing. Now you can
Hmm.
quickly better understand those. So start to understand those, find patterns, think about how you want to show up as a brand with across those personas. Watch what's going on with Google and how much of the healthcare informational experience is going to move into the search engine where people
Hmm.
are getting their questions answered by generative search, and start visioning and prototyping, because we know we can use AI to prototype and iterate pretty quickly. Start thinking about what you think that future website, healthcare website experience would be, where now you have the opportunity to offer a much more emotional experience for patients to really help them understand
Hmm.
how your brand can really help them in their health journey. You don't have to tell them what is breast cancer. They got that answer on Google and in generative AI, but there's still value you can provide as a healthcare organization. And what does that look like?
Yeah, I'm curious to get just because I've gotten to know you, I know I get to I can go into a future state question now, at least to get your view on. I'd be curious in listening to you there. Are you placing a bet or even just placing a space that it's much more about kind of like the technical infrastructure and data infrastructure and less about this like single platform? And I'll give more of an example. In that phone example, the phone operator or the OS operator, maybe even just the browser operator may control the visual output, but they're going to
Mhm.
have to source the data from somewhere. Where does the idea of a CMS or a single kind of interaction become less important and more of just the ownership and structure of the data?
Yeah. Yeah, I think we've seen this trend already as websites have moved to headless models where the CMS is decoupled from the front end experience. And a lot of the reason for that is so that you can more efficiently connect to different data sources and you can serve the same content to a mobile app as to a website. So we're already seeing those things separate and it become kind of a network of connected data sources. And you see the same thing on the AI side.
Mm,
There's been a lot of work in healthcare. We talk about interoperability in the AI space. Interoperability is this thing called MCP. MCP is what allows different AI agents to talk to each other and understand each other. And it's a protocol that all the major tech companies have
mm,
adopted. And so AI is like out of the box interoperable, which we
mm,
understand in healthcare is important. And that's how, again, we've been thinking about AI. We train individual AI experts and then it's about pulling together the right team for a given task or project. And so both from a data perspective and it's about pulling the right data into that story as well. Going back to that media example, the media team, we've created a way to only pull into the AI the insights, the data points from the campaign results that are relevant to the story that needs to be told. We don't need the AI to understand a breakdown by audience if we don't feel, if the social media person doesn't feel that a breakdown by audience is going to provide a meaningful insight at this point in the project to the client.
mm.
We can exclude that data so we're not. So this idea of being able to pull in only the pieces you need, and that brings us back to making sure you're giving the right context up front. Yeah.
Yeah. Well, I just got to say it was a pleasure. And you
Yeah.
embody the word authority when we think about the name of this podcast. And our definition of that is really this healthy balance of theory and practice. And
Yeah.
I enjoy balancing that, kind of zoom in, zoom out with you. So just want to say I'm appreciative of the time. And if people want to kind of keep in touch with Teri or White Rhino, especially with where you're going with these landing pages, is there the best way for people to keep in touch with you?
Yeah, they can just email me. My email's really simple. It's teri@whiterhino.com. And on LinkedIn, I'm pretty active on LinkedIn, posting about some of the things we're coming out with, and always happy to have a conversation. And we've got some fun tools, the persona builder that we mentioned. Happy to share a little bit more about these really dynamic web experiences for anybody that's interested in learning more about what we're doing there, and or just having a general conversation. If you're stuck and thinking about, I like the idea of personalization, I don't know where to start. Happy to have a
Mm.
conversation. Yeah.
I think that's a key one, and I'll definitely be on that list of staying in touch. So I'm always appreciative of the time, Terry.
Excellent. Thanks for having me again.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.